Okay. Wow. Now we're doing it. Hi, everybody. Welcome. Today we're going to talk about something that affects every single one of us, and that is love and loss and the complex journey of caregiving and grief. End of life is definitely a topic that I think a lot of people tend to shy away from. It can be difficult to navigate, difficult to face, but it's also one of those things. It is a deeply human experience. And if you have yet to go through it, um, you will. I mean, that's just a fact. I think about the TV show WandaVision. I don't know if you guys saw it, but that amazing quote from it, but what is grief? What is grief but not love persisting? Um, Love doesn't end when life does, but grief also begins a lot of times before the actual loss. A thing I've experienced myself. It's very complicated. And this conversation that we're going to have with these incredible panelists is just about holding space for all of it: sorrow, connection, challenges, and also the moments of absolute beauty and real transcendence I have experienced that caregiving at the end of life can bring. So we're very honored to have an incredible panel. Let's just get right on into it. Larissa, I would like to start with you. You're a mindfulness expert, an Ayurvedic practitioner, end of life doula, and you really help families find grace and presence and love at the end of life. Um, how has your work in yoga and Ayurvedic medicine and all of those things, how have those practices helped you help individuals and families keep love really at the center of end of life care and saying goodbye?
Mm. Thank you, Busy. It's such an interesting exploration. The wisdom traditions, the contemplative traditions, they all teach the same approach here. When periods of life are really busy, when they're complex and complicated, when one feels overwhelmed with responsibility, the remedy is to simplify.
Mm,
So when life is complex and complicated, the remedy is to simplify. And often what happens for caregivers, the first thing that they forfeit or sacrifice is self-care,
hmm
and then get exhausted and burned out, depleted, overwhelmed, spread too thin, and there's very little energy left to be present and to savor those mindful moments with loved ones and family members at the end of life. And that's why caregivers are here today, right? They're burned out, they're exhausted, they're looking for a solution. And the solution from the contemplative traditions is to simplify.
hmm
And so caregivers might be thinking, well, like, how the F do I do that when
Yeah, I
life
was
is
gonna
so
say,
busy?
what? Yeah,
Like
what does that
what does
mean?
that
Like,
look
what does
like?
that look like?
It's so intense, right? Because there's a list of to-dos that just seems endless, right? Caregivers are often overwhelmed with responsibilities, and that can create a kind of tunnel vision for caregivers. Speeding things up, nose to the grindstone, trying to push harder, do more, sacrifice more, get more exhausted in order to somehow reach some kind of point of balance or
Mm,
ease or comfort. And we know that that doesn't work, right? That doesn't work. It's not the solution. That that list of to-dos will continue to go on. And so, especially when we layer on the complexity of anticipatory grief, so there's the list of to-dos, and then there are all the complex and complicated emotions that are arising. A caregiver can just zone out, tune out, and miss this really important time to slow down and be present with loved ones. And so the wisdom traditions teach, and what I really want to invite caregivers who are here today to explore, is there's an opportunity to expand the realm of possibilities, expand the field of possibilities as a caregiver. There are opportunities as a caregiver amidst all the busyness and craziness of the day. There are opportunities to reclaim mindful moments,
mm,
to reclaim mindful minutes in the day, to recharge the batteries slowly and consistently so that there is energy and time and space to be present.
And
And
so
I it's
can I ask,
yeah.
um, so would that, for, in my experience, I remember going outside and taking my shoes off and walking in the grass.
Mhm.
And so I'm curious if you had any other sort of like practical applications, rituals or techniques that the people who are watching this could maybe keep in mind.
Absolutely. Yeah, I've written a number of articles. I created an audio course called Mindfulness for Caregivers that has a whole host of what I call mindful minis, practices that are research based that help to prevent stress from accumulating, help manage stress in the moment, and help to recover from stressful events. So it kind of they do all the things, and they're very simple practices that can take 15 seconds when waiting for an Uber,
Mhm,
or a minute while waiting for a loved one to come out of an exam, waiting for the elevator. There are so many moments and minutes in the day where folks go to scrolling, or they try to fill it with something else, or they zone out or whatever, and it's an opportunity to actually pause, slow down, be present, and do things like gentle mindful breathing practices,
mhm.
mindful repetition of phrases that support a sense of calm and ease, and even little mindful movements like just roll your shoulders a little bit, take a little stretch, swig some water, those kinds of things. And after my colleagues share a bit about their experience, maybe we'll do a little together in the next round.
Okay,
Hmm.
sounds great. Katie,
Hmm.
you're a nurse practitioner, an end of life coach, and an author who's very passionate about bringing awareness to death and dying while also advocating for caretaker well-being. And your work really emphasizes on the importance of awareness and education around death and dying. I do think that a lot of family caregivers struggle with the emotional weight of preparing for the inevitable while also providing care in the present. What are some ways that caregivers can begin to embrace conversations about death in a way that fosters love and connection rather than fear?
Yeah, it's a great question. And I think you're right. I think one of the, maybe if not the biggest struggle that families and caregivers deal with when a loved one is dying is fear and is uncertainty around what's happening, what to expect, what's normal, what to do, how to help, what to ask. And on top of that, someone is grieving as well. I also truly believe, and sort of bear with me when I say this, I truly believe that we are all given a really powerful gift when we as family and caregivers know that our loved one or our person is dying.
Mhm,
And that is the gift of time
mhm,
compared to someone who dies suddenly and there is no time. That time is a gift because it gives us all an opportunity. It gives us a chance to say all of the things and to ask all of the questions, to say, I love you and thank you, to forgive and ask for forgiveness, to say goodbye, and even to give our loved one or our person permission to die, to let them know that they don't have to hold on for us anymore, that it's okay and we're going to be okay, and really releasing them of that burden and that worry. And some of the questions I think about are things like, what do you value most about your life? What's most important to you? And what do you worry about the most? And how do you want to spend this time? I think that when we have that time, we have that chance to say just all of the things and to ask all the questions, it's helping to guide us. It gives us the confidence that we know exactly how to honor our loved one through this part of their journey, through this part of their life. And it also gives us that peace of mind that we've said everything we needed to say. There's nothing left unsaid, because so much, I think, of what we say to our person, to our loved one, whoever it is in this time, while yes, it's for them, I think maybe more so it's for us because we're the ones who have to keep living. And maybe this is one small way to help us kind of move forward.
Yeah, I think that's really accurate. I guess also a question that I have is if a person that you are caretaking has dementia or has, if we're dealing with that sort of thing, how do you, as the caretaker, make peace with that?
Yeah, you know,
When you see your person confused or scared, them that and that how do you as the caretaker try to find peace within that?
yeah, you know, I think it's we still can go back to like what are the things that we are doing to honor them. You know, I think when we've been caring for them or we know them, you know, for a long time, or if we're a family caregiver, we've known them for life, we know, you know, how they live their life. We know what they value. We know what mattered to them.
Hmm.
And we can still do the things to support that, to support their values, to support what mattered to them, you know, along this part of their journey, even though they have that confusion or they aren't aware. I also think, you know, kind of going back to saying all the things, you know, the I love yous, the thank yous, the forgiveness, all of that, the goodbyes. There are, I can share, I mean, countless stories and countless times. I mean, my husband was one of them, sitting at, you know, his dad's bedside a week before he died. And he had some form of dementia. It was actually undiagnosed, but he was very, very confused. And he didn't have clarity, but in that moment,
Mm.
had clarity with my husband the week before he died. And they were able to have those conversations. So and it happens time and time again when I'm with, you know, patients or clients at their bedside, family members at their bedside. You never know when that person with dementia is going to have that moment of clarity, and so it's not too late to try.
Mm. I think that's really important, and it's important for the caregiver as well to try.
Yeah.
Joelle, you are affectionately known as the Grave Woman. You're a funeral director, a grief coach, and an educator who specializes in culturally inclusive end of life and grief care. Different cultures obviously have unique ways of honoring death and grieving and saying goodbye. And for family caregivers who are navigating the end of a loved one's life, how can they ensure that cultural traditions and rituals and beliefs are honored, especially when facing, medical or institutional settings that may or may not be attuned to those needs? Did we lose her? Where'd she go? She disappeared? Okay. Well, listen, when she comes back, we're going to find out. Um, let's move, Dr. Smith. I'm going to move right on over to you.
Sounds good.
How you doing? Uh,
Good.
so you're a palliative care physician and a medical director at Stanford, where you help families navigate end of life care with dignity and compassion. Many family caregivers struggle with, the idea of palliative care, and the misconception that palliative care is just giving up rather than an approach that really enhances the quality of life. How do you help families reframe their understanding of palliative care so that they can see it as a way to center love and dignity in their loved one's final chapter?
Yeah, thank you so much, Busy, for this question. And I really appreciate the way you framed the question. Simply put, our goal in palliative care is really to work together with the individual who's living with an illness and their family caregivers to simply just make life as good as it can be. And I think it's really important for people to know that palliative care can actually be available at any age or at any stage of a difficult illness like dementia or other neurologic diseases. And think of us as like an extra layer of support to your other team members. So we don't replace a neurologist, a geriatrician, or primary care doctor. You can see us in addition to all those other services. And you can continue any treatments you want. You don't have to get any treatments. We're here to support no matter what kind of the care plan is. Again, just really focus on trying to make life as good as it can be. So you can really see a palliative care team from the time of diagnosis all the way through that final chapter of life. So we are different from hospice in that we can see people across the full spectrum and time course of their illness, while hospice really does focus on that very final phase of life. I'd also just say that I think palliative care really shines through our interdisciplinary team model. I'm here as one of the doctors from a palliative care team, but I work really closely with nurses, social workers, and spiritual care providers because we know that an illness like dementia, of course, there can be physical symptoms that are bothersome to the patient, but there's a whole nother psychological, emotional, practical, sometimes spiritual or existential, all those issues kind of get brought up. And we work together as a team to really try to address all those different aspects of life that can be impacted. So some of the practical ways we might help: as a doctor on the palliative care team, I might prescribe medications to try to help control bothersome symptoms. I do a lot of advising and guiding about what are some medical decisions that might be coming down the pipeline that we need to prepare for, or how are we going to navigate those decisions when they do come. I work with our social workers to think about, gosh, how do I match the care needs that are coming up with the resources that are available? So that might mean sometimes I order medical equipment for the house or help to get home health to try to work with like PT or OT at home, physical therapy or occupational therapy, or connecting families to caregiving agencies to try to get some more help in the home. For those who might be interested in palliative care, the way to get connected to us is to ask your current providers for a referral. We're kind of a referral-based system. And we're fortunate that it's a growing field. There's great palliative care teams across the country. I'll just wrap up by saying again, Busy, I really like the way you asked the question. I love thinking about palliative care as a service that really centers love and dignity at the end of life, but also throughout all the ups and downs that can happen when you're living with a tough illness. So thanks
And
again for the question. Yeah.
well, I also wanted to, because this was sort of brought up, it was brought up in the chat. And of course, like if you get the referral, perhaps your insurance, it depends, varies from insurance to insurance, but is it something that can get covered by insurance?
Such a great question. And in general, the answer is yes, that we're covered just like any other medical specialty. So if you go to see the neurologist, you probably got a referral from your primary care doctor to go see that specialist. We're in that sort of same system. So you might have a copay, just like you have a copay with your neurologist or cardiologist or oncologist, whatever the specialist is. But we're sort of just the same as that.
That's good to know, and it's great information that you can ask for the referral. You can ask if you're interested.
Yes, please feel empowered. We know that our colleagues are awesome and very well intentioned. They are also still learning about palliative care and when and how to utilize us. So don't be afraid to be an advocate. Use this session as like, hey, I heard from a palliative care doctor. This could be helpful for me.
Okay, that's really, really helpful. Joelle, I'm happy that Zoom let you back. I'm sorry that you were kicked out of here. So let's go back to what we were discussing, which was a little bit, you know, more about the culturally inclusive, you know, traditions and rituals and beliefs, and how to make sure that those things are honored, especially if you're in, you know, a medical or institutional setting that perhaps might not be that, you know, attuned to those needs. Um, how can family members and caretakers ensure that they are heard and that their needs are met?
Definitely great question. And I apologize. Zoom did something weird. But I think it's important to first address the elephant in the room before we answer that question. And that elephant is the fact that communities of color have a very different end of life experience and healthcare experience than other communities in our country and around the world. And a big differential is the fact that cultural nuance is not taught in our healthcare system. Most of our textbooks, as far as medical textbooks, research done, they're based on a very white standard. And when you're dealing with diverse communities, you have to take in consideration the fact that people have different lived experience. There may be a level of mistrust with medical providers or people coming into the home of communities of colors based on multiple facets, not just a racial facet. And I think it's important that families understand that being open about those concerns can be beneficial. And perhaps having either a cultural advocate, a spiritual advocate, or even just someone in the family that can speak up and help providers, practitioners, and medical professionals understand that this is our culture. This is what we do not only in our family, but this is what either our religion or our cultural belief requires. Having different conversations and using different language around hair, around care, around anatomy may be impactful, and making sure that professionals that are coming into the home or providing care, or even when leaving loved ones at care facility, having those conversations about cultural differences and what's required by someone's belief system is important.
And when you say, it might be beneficial, if the primary caretaker or the family member feels too overwhelmed, for instance, to be able to keep track or know who to even talk to, um, how would you advise a family member, the primary caretaker, to best handle that, like a spiritual advisor, a priest, or someone else in the extended family? You know what I'm saying?
I do. And I think the best way to go about that, I know several hospitals and now many care homes have chaplains, and having a conversation with the chaplain about what it is that your loved one requires, what experience they may have lived through. I live in the South. And so, working in dementia care units earlier in my career, I learned that families coming in and dropping their loved ones off in care facilities was traumatic because there was no one there providing care for them that looked like them, thought like them, prayed like them, experienced grief the way that they did. And I've heard an Alzheimer's diagnosis compared to a funeral that never ends. And so that level of anticipatory grief, getting support for that grief that you're experiencing that's overwhelming you, while leaning maybe on that chaplain, or if you're lucky enough to have a provider that seems as compassionate as Dr. Smith, being honest and vulnerable and kind of breaking that ceiling. But then there's a level of responsibility, I believe, on the care team to ask those questions. Something as simple as, what is your cultural background? What does your belief system say about death, about grief, about transition, and what's required in this moment? How can I better serve you or
That
care for you?
that is incredibly powerful, and I really think that it's very valuable. Thank you. Cindy, you are a literature professor and an author who has explored the intersection of language and loss and dementia through both very personal and academic lenses. Your journey included studying neurology and shadowing physicians while writing about your father's experience. As caregivers, family members often feel caught between emotional and scientific aspects of dementia. What insights from your work can help caregivers reconcile with the medical realities of dementia and the deeply personal and emotional aspects of loving someone through cognitive decline?
Great question. I should say that the impetus to write this memoir about my father, who was diagnosed with early onset Alzheimer's in his 50s, was the fact that he was losing language. That was his primary clinical presentation at the same time as I was in graduate school becoming an English expert. And so I would read a book a day to study for my orals, and he would be losing words every day. And it was that sort of horrible synchronicity that I needed to get my head around. And it took me decades to get my head around it. And part of the difficulty, I think, was I knew nothing about grief other than there were certain stages of it, and I wasn't meeting those benchmarks, to put it mildly. And what I've learned is everyone grieves differently, and that's okay. And I wanted to write this book with a neurologist because it was really important for me. And I think because I teach at a STEM-oriented school, it was important to me to try and get an expert in the field of neurology to explain some of the things I was seeing that were so difficult. My father getting lost when he was driving somewhere, pointing the golf club in the wrong direction, not knowing a word, pulling a sink out of a wall in a assisted living, like what was going on in his brain. And the neurology part of it turned out to be really important for me to learn about. And it was only a year of learning neurology, but I got a bunch of words that helped explain what the hell was going on. And with those words, I got power. And I wanted to write this book with this neurologist, Dr. Bruce Miller at UCSF, to empower readers and caregivers, because I wanted a glossary so that readers wouldn't hear for the first time aphasia or the hippocampus, but they would be sort of armed going into the doctor's office, knowing some of the words and being kind of empowered to ask questions, because
Yeah.
the diagnosis is so shattering. And the hierarchy with the doctor is so intense that it seemed very important to give caregivers strategies of all kinds. And so learning these new words helped me, and I was sure it was going to help other people too. And so that's why we wrote the book together.
And I just want to mention the name of the book is Finding the Right Words, just so that people who are at home can get the
Thank you.
book.
Thank you.
And I think that certainly it's incredibly empowering when you get a diagnosis like this to be able to at least follow some of what the doctors or specialists are saying to you in that moment. Um, Larissa, I want to go back to you. I want to circle back. We have a little bit more time, and and talk about caregiving, especially at the end of life, which can be very emotionally, obviously, physically draining as well, exhausting. Um, how can mindfulness and practices rooted in, Ayurvedic medicine support caregivers in what you had talked about earlier, which is like really being able to stay present in those moments, um, because I think it's really important. Um, so, and managing your own stress so that you don't get sick, you don't, collapse, you don't forget to feed yourself or, take care of your own self. What are some of those practices, and what do you, and also the challenges navigating anticipatory grief?
Man, it's huge, right? As a caregiver myself who went through just ridiculously intense caregiver burnout at one point early on, I certainly relate to the exhaustion that so many caregivers experience. I'm really interested in reading Cindy's book. My father passed from dementia when he was 59, so now 23 years ago. Just a couple days ago, I celebrated, and there's something so interesting for me in I wasn't his caregiver at that time. I was just his daughter, and didn't have many words. But I found that as the disease progressed, what became most precious were the wordless times when I was able to just be and not do, and to share, as Katie said, to say the things, and there can be forgiveness, there can be resolution, there can be a sense of completion, even when it's not two-sided, even when we don't get a response. There's something energetic that happens when we slow down and can really be present. And mindfulness practices and yogic practices and all the contemplative traditions teach techniques to support one's nervous system in slowing down enough to be content in that space of not knowing, in that space of confusion, in the time when there are no words, you know. And so some of the practices that have been most helpful for me as a caregiver over the years, and I do a lot of it, um, trying to get good sleep, working to stay hydrated, you know, always having herbal teas and water with me when I'm caregiving, choosing to favor lots of fruits and vegetables and whole foods and whole grains and to eat in a mindful manner, because when we eat while multitasking and stressed, we know from modern research that the fight or flight nervous system is in charge, which means that food cannot properly be digested, which means we miss all the energy from that food, and it creates even a toxicity and residue in the system that can create more cloudiness and foggy headedness. It's like a terrible spiral, you know. And so the mindfulness techniques support one in slowing down and being more present. And some of the ones that are most useful for me are things like loving kindness meditation, which
Mhm.
can be a formal practice of filling one's own well, you know, recharging one's own battery by repeating phrases like, may I feel calm and content, right? Folks can listening can repeat that with me. May I feel calm and content. May I feel peaceful and at ease. May I feel calm and content. May I feel peaceful and at ease. And I would repeat those words, I still do all the time, or any other, you know, present tense positive statement like that. I repeat those words when life feels overwhelming. And it's a way of reclaiming a sense of agency, power, self soothing, self regulation that
Mhm.
then allows for, you know, not only the recharging of the batteries, but the recharging of the energy and the clarity that allow for more of that connection and the ability to savor this precious time at the end of life. And so it can sound like so simple, you know, like it's too simple. And this is often what, you know, the contemplative traditions face is, you know, the critics say, like, oh, the remedy is too simple. How could that possibly work? Like slowing down, taking a few mindful breaths, taking off your shoes like you did, Busy, and getting your feet on the ground, you know, pausing and drinking a cup of herbal tea in a relaxed manner, staring at the moon and taking in 3 deep breaths, you know, rolling the shoulders for 10 seconds between, you know, meetings with the doctors. Like those things do add up.
They
They
do.
do make a difference. And it is a way of reclaiming one's power. Yeah.
Yeah. I also I found, I mean, it's rooted in Buddha, like a Buddhist tradition, but also
Mm,
the Hawaiian healing practice of
mm,
I love you, I'm sorry, please
mm,
forgive me, thank
mm,
you. And I would
mm,
say it to myself. I mean, you know,
mm,
you say it over and over again. I love you, I'm
mm,
sorry, please forgive me, thank you. I
mm,
love you, I'm sorry,
mm,
please forgive me, thank you. Um,
mm,
Katie, in your book, Dear Caregiver, It's Your Life Too, you highlight really the emotional toll of caregiving and many family caregivers. This is, I mean, we're all talking about the same in the same space, uh, especially when you're supporting a loved one with dementia. The anticipatory grief is so huge and can occur long before the death occurs. Um, how can caregivers hold space for their own grief and still show up with love and presence for their loved one?
Yeah, not that that's easy. Especially caring for someone with dementia whose care needs are huge. I mean, 24-hour care needs. So it's not easy. And I think that when we as caregivers can find some way to prioritize ourselves too, we'll be able to show up in a better headspace and a better heart space with the person that we're caring for, with our loved one or whoever it is. So I actually really like the ABCDs, the ABCD model. I think it can be really helpful. It's something I teach. It stands for A, uh, basically just acknowledge our grief, allow and acknowledge our grief to be present. B is bonding with others. C is caring for ourselves. And then D is doing something with our grief. So by all of that, I'll sort of explain them a little bit. So acknowledging and allowing, back to A, basically allowing whatever our experience is, whatever our grief experience is, allowing it to be there and to take up space, to be present, not trying to shove it down or resist it, just allow it to be there and acknowledge that whatever we're experiencing, actually, no matter what we're experiencing, the good, the bad, the ugly, that it's all normal. And kind of, Cindy, back to kind of what you said, I think if there's one thing to take away about grief, it's that there's no right or wrong way to grieve. There's no right or wrong time frame to grieve in. Your grief experience is normal. So that's A, acknowledging and allowing our grief to be present and normalizing it. B is bonding. I think especially as caregivers, especially maybe for someone who's caring for someone with dementia, it can feel, pretty lonely and isolating when you're a caregiver. And so having some sort of bonds or connecting with other people, someone you can share with, someone you can rely on, a support group where people are going through similar experiences, it can just feel so validating and I think supportive in our own caregiving journey. So that's B for bonds. And then C, caring for ourselves, self-care, which I know I've heard it, like when you're a caregiver, you're like, I've been through it too. Like, I don't have time or energy to care for myself. What are you talking about?
Larissa brought up a great point, which is like eating fruits and vegetables, remembering that it's okay to sit down and take your time, take some deep breaths,
Yeah,
slow it down.
exactly. And I was actually going to say, Larissa, I teach something similar. Keep it basic and keep it bite size. Like
Yeah.
the basics of surviving, eat well, hydrate your body and get sleep, get rest. That's how we survive. And then keep it bite size. We need 5 minutes. Can you take 5 minutes to enjoy your cup of coffee or your tea or your hot shower or step outside, whatever it is you enjoy? All you need is 5 minutes. So that's the C, care for yourself. And then D is doing something. Do something with our grief, because grief really likes to take up a lot of space, I think, in our minds and in our bodies. And it can get stuck if we don't do anything with it. So finding some like healthy ways of expressing and releasing that grief, things like going for a walk, like get active, do something active with your body, or journal, dump it out on paper, draw a picture on paper, or just have like a really good cry, doing something active to release all of that grief from our minds and bodies can just help kind of clear it out. So yeah, I think it just like follows through and allows us to, gives us that space and then allows us to show up with a better head and heart space for the person that we're caring for.
100%. We really are running out of time, which is a bummer because this is such helpful information and I think really valuable. Joelle, I just want to jump back to you for 1 minute.
Okay.
Because it's also, I think, very valuable for caregivers. What's like one tip from you on how caregivers and professionals alike can advocate for more inclusive and culturally competent support systems?
I'm going to just share our motto at the Multicultural Death and Grief Care Academy. And that motto is culture is the medicine for grief. Everything that we know about life, about death, and about grief and the way to manage it, whether we believe it or not, is rooted deeply in culture. And due to colonization, culture has been erased. And the best thing that we can do is to return mentally, spiritually, physically, and in all ways to some of our indigenous cultural practices, learning about those practices, exercising those practices, and developing intimate, authentic, individual connection with our culture is the medicine for grief.
That is really incredible and valuable and a perfect, I think, place to end on. I want to thank the incredible panel so much. Dr. Smith, Cindy, Finding the Right Words. Katie, your book is Dear Caregiver, It's Your Life Too. Larissa, you shared that you have lots of information on your website and people can get there. And the palliative care information, Dr. Smith, thank you so much. Audience, thank you for joining us. All of the caretakers out there, we're sending you the best, and I hope this was very helpful for you. And if you would please, go back to the lobby or chat and head to the Scotty Awards session. And thank you so much.
Thank you. Thank you all for coming.
Thank
Thank you.
you.
Thank you.
Thank you, everyone. Thank you so much, Busy.